Hello there, my name is Carlo Oger. I'm a board-certified emergency physician and I produce medical education videos like this one. This one I have a special interest in because I'm going to discuss some issues about my own health and how I'm taking the steps to prevent further deterioration, improve my health, and get better. I'm going to show you a quick video, a clinical video, and an actual picture. So stay with me. And I am exposing myself with this. It's a little embarrassing, but yet I do believe that by sharing this, we're going to be able to learn together, improve together, and you can see why this is so important. So let's watch this video here. I'm going to pause it and then kind of share it. This is actually my own mouth that I'm going to be sharing with you. I take good pride. I think I have a good smile. I have like a chronic food trap that was getting inflamed. The dentist, last time I saw him, kind of grinded some stuff to prevent some further deposits there. But I was finding my gums were pretty sore. So it wasn't until I took a better look inside and saw this that I absolutely freaked out. So I'm going to start here, and you can see on the side. And what you can see here is that my gum line is more red than it should be. It should be more pink. You can see a lot more redness in the bottom here. But this is what really freaked me out right here. You can see that the gum should be nice and dome shaped around the tooth, and this one's tracking all the way up right there in the middle. This one a little bit, but not so much as that one. So that's called periodontal disease. The actual gum has receded, has created a triangle there of exposed base of that tooth. And that's when I said, okay, I need to make a change. I need to figure this out. I need to get my oral health better. I'm doing it on one side, and then I'll share a video on the other side. And of course, I do brush my teeth well. As a kid, I had a lot of cavities and fillings done, but last time I've gone to the dentist, I haven't had cavities or anything. We've been replacing some of that old fillings with new fillings over time. It was like a year before my last appointment to this appointment because I moved and there were no appointments to be had. So the reason I'm making this educational video is to talk about gum disease or gingivitis, and about periodontal disease, which is the more severe form of gingivitis, and what you and I can do to prevent, to treat, and to improve. So the first thing we're going to talk about is the differentiation between gum inflammation and gum disease. Inflammation, the gums are a little swollen, a little sore, they bleed when you brush or when you floss. But gum disease is a more permanent disease and can lead to permanent tooth loss. So half the population have gum disease at any given time. 5 to 15% of these are severe disease or irreversible. So you really have to be aggressive about preventing any further deterioration, maybe a little bit of improvement, so that you don't lead to bone loss and then tooth loss altogether. Why is dental health so important? Because the mouth is the entrance of your body. It has been associated with a number of medical disorders, including blood clots, cardiovascular disease, even stroke, rheumatoid arthritis, diabetes mellitus, and not just that diabetes can lead to gum disease, but the other way around. We don't know exactly how that mechanism works out, but if you have bad health in one, you probably have bad health in the other. It's kind of like a two-way street for diabetes. And surprisingly enough, dementia. So people with bad dental disease have increased chance of dementia, and not because they're demented, they're not taking care of their teeth, but rather the other way around. And again, a two-way street. People with early gum and dental disease have higher incidence of dementia. So this is why it's so important. It's not just about a nice smile, it's about a healthy smile. So what are the signs of gum disease? Well, it starts with simple stuff. Gum redness, gum swelling, so you feel a little bit of soreness. You have a food trap, you brush your teeth, there's a little bit of blood. Now, the bleeding usually is with brushing, then it's get more with eating, or it can happen spontaneously, and that's more severe. So mild brushing or flossing, when eating and you have a little bit of blood, that's more severe, and eventually spontaneous bleeding, which means that it's progressed and the inflammation is more severe. Sore and tender gums and teeth, and then recession. The gum actually, because stops being dome shaped and it goes higher up like a big arch, or triangular like you saw on the video that I showed you earlier, and so on. And bad breath. Usually the same thing that causes gum recession, gum loss, tooth loss, is bacteria in your mouth, and those bacteria, when they're hyperactive in your mouth, produce bad breath. So for not than any other reason, it's just the fact to have a clean mouth with a good breath is reason enough to get this done. So here are some of those symptoms. We talked about bleeding gums, red or swollen gums, bad breath, receding gums. You can see the picture here showing a nice gum, and then a receding gum where you can see a lot more of that tooth, and ultimately tooth loosening or even tooth loss. So gingivitis just stands for gingival, and then itis for inflammation. In gingivitis, it destroys the fibers that attach the gum to the tooth. So then there's a space between the gum and the tooth with further plaque, which is essentially a sticky film, a biofilm of bacteria and fibers gets in there and cause further injury or damage. So once that plaque gets bacteria and gets calcified or hardened, it becomes tartar. And tartar is the one that the dentists have to scrape out to get out, or you can have really good toothbrushes, good flossing, good toothpicks to get that tartar out. But that once you get to that stage, is like calcium, it's really stuck in there. So brushing alone probably won't do it. So different stages of this gum disease. We got plaque buildup, starts above the gum. You can see on the picture right here, so it's right above the gum, but then it starts tracking down like this. So your mouth bacteria is constantly creating plaque, which sticks to the teeth, that biofilm that sticks. Daily brushing and flossing removes most of that plaque, but what remains can gradually harden and become tartar, which only a cleaning by a dental professional can remove. At that point, it's stuck in there, is calcium, and needs to be scrubbed out. This buildup can lead to gum infection, not just gingivitis, but active infection. If bacterial plaque is not removed, gums can become infected and inflamed. This is gingivitis, an early form of gum disease where the gums may be bright red, swollen, and even bleed. Bleeding is not normal. It shouldn't bleed, even with the flossing. So if you've been flossing consistently, you'll notice that you bleed very little or occasionally in one tooth or the other. Fortunately, professional cleanings or at-home care, aggressive, good care at home, can reverse early gingivitis. Stage 3 infection can spread, causing pockets between your gums and the teeth, and then to tooth loss. You can see it right here on the picture, that separation and those particles there between the gum and the tooth. If untreated, the gums can pull away from the teeth, creating pockets that allow bacteria to spread into the root of that tooth, and over time, bone, gums, connective tissue supporting the tooth can be permanently damaged and injured. Teeth can become loose and might need to be removed, which is no bueno. So the advanced stages of gingivitis and gingival gum disease leads to tooth elongation. You can see a lot of the tooth, including the root, exposing this root surface, which over time causes a layer to thin out between the outer tooth and the nerves inside. And that's why you get sensitivity, pain, cold and hot intolerance, and so on. So how to control gum disease? Number 1, make sure you see a dentist at least twice a year. If you already have gum disease, you might need to see them earlier or sooner, more frequent than that. Brushing, you want to make sure you're brushing not just once a day, but minimum twice, maybe even after every meal, to decrease the big particles of stuff stuck to the teeth and therefore prevent any further deterioration. And when you do brush, you don't want to be too aggressive. Actually, brushing very hard can then damage the gingival growth and healing and so on. Flossing, it's important that you floss minimum once a day, hopefully twice a day. But better than flossing with the cord or the string is a water pick. As literature has been showing, that water pick and that pressure going is more effective than flossing alone. So there are different instruments and things you can purchase to do water picks and water flossing. Like for example, this water pick is what I purchased to help me out in my own cleanings. If you do smoke, vape, chew tobacco, definitely no-nos. That's overall bad for your dental health. Marijuana, of course, any recreational drug would be bad, especially cocaine, because cocaine is a vasoconstrictor. It'll decrease the blood flow to your gums, especially people who use cocaine like this. They have really bad dental disease because there's poor blood flow to that gum. So here's some tips for healthier gums. Do not delay treatment. You see anything like me, start right away. I mean, I've gone a little fanatic about it, and I'm doing a special toothbrush, and I'll talk to you more about it in a second. Make oral care a priority, not just something that you quickly do, but that you purposely attempt to improve on your own health. Sometimes succeeding in one thing makes you want to succeed in the next, and starts this ball roll of success and wanting to do better. So start with one goal and achieve it, and then the next, and so on. So consider products like this. We talked about the water pick because it's been shown to be better than flossing alone. So it's high pressure water in between the teeth. It helps remove that bacteria and tartar. If you do have gum disease, then you can use something like this, where it's a gum detoxify. This one's brand is Crest, but there's many other brands you could try and use. But they have special chemicals in it that help kill the bacteria, and more effective than plain toothpaste. And mouthwashes, Listerine washes, and any kind of antiseptic. This one's specific for gum disease, so it has other things in it that the other flushes don't have, that can help improve overall health and effectiveness of your dental care. Drink plenty of water, and water, not just fluids. So if there's high sugary drinks, those tend to aggravate and make this heal less. And we already talked about smoking, chewing tobacco, and so on. There are some natural remedies you can try. There is an evergreen extract called neem, and that has been studied well, and you can use that. A tea tree oil. This has been shown to be superior to chlorhexidine, which is a chemical that we use for people with dental infections, lacerations of the mouth. We have them do gargles with chlorhexidine. So tea tree oil has been shown to be superior to this. Cranberries and cranberry juice, yes, they're high sugar drinks, but its effect on the mouth and blood flow and so on, it's been shown to be good. Vitamin C, because it increases bone density and health, the ability to make more dentin, and so on. Coconut or sesame oil pulling, that one I don't know if I would do. It's 15 minutes of putting the oil in your mouth, 15 minutes holding something in your mouth and then spitting it out, but that is supposed to improve your dental health, your gum health, and so on. And then you want a diet low in sugars. So those are the things you can do that at home to help yourself. Of course, go to a professional to get professional cleanings. Now, the stages of periodontal disease, on early gingivitis, that's the one that you can reverse. That's the one you can be aggressive, use products specifically designed for gum to help your overall gum health. But once it gets to moderate gingival disease, becomes periodontal disease, that's more permanent, and it leads to bone loss and tooth shifting, and then it starts loosening up. And when it's advanced periodontal disease, then you have laser surgery you can do to stimulate the gingiva, or surgery where they take flaps of skin and they replace it and they fix your gum, basically. You don't want to get to that. There's also prescription antibiotics that you can kind of like literally run through your mouth to help with controlling bacterial counts and therefore gingival inflammation. There's also treatment about scaling and root planning. Scaling is the manual removal of tooth plaque and tartar from teeth and their roots. That's something that's done now when you go to a professional clinic. It's called scaling. But when you go deep, like into the gum, that's a little more invasive. And then planning is when you smooth out the rough spots on the roots that are already exposed. You can't make that gingiva grow back up. But by smoothing that down, then there's less plaque to stick to it, or food particles and stuff like that. So in planning, you smooth out the rough spots of the tooth so that particles of food and things don't stick to it. You smooth it out so it kind of like flows and it doesn't stick to it, and it doesn't allow bacteria to gather and stick to the tooth so much. And that's it for today. We talked about gingival disease, gingivitis, when it's periodontal disease, things you can do right at home, like have specific products for gum, have a water pick to have help more professional, more rough, the cleaning in between the teeth, and use a good toothbrush, a mechanical toothbrush. There's different brands. The one I bought, maybe I'll show a picture here, is the Oral-B IO. It's the Mac Daddy, has an app. It monitors the time I spend brushing my teeth, what teeth have I done, how well I've cleaned. It has me grade myself on how the gum is looking today. It encouraged me to do the flossing because I have to document it. It gives me little medals and things like that to encourage me to do better. So something like that, it's great because it does a much more efficient job at the cleaning. I felt like I've had professional cleanings every day since using the toothbrush. And number two, it monitors your overall health by self-assessments. So I really think if you have any kind of dental sensitivity, dental disease, gum disease, gingivitis, that you consider these products. I'm going to put a list down in the description below. You can purchase them through Amazon and so on, and start working on your own dental health. All right, I hope you learned something today. Thank you for watching this video, and we'll see you on our next educational video. Thank you.